And last week, we told you about a new proposal that would require public libraries all across Illinois to keep medications that can reverse an opioid overdose, like Narcan, on hand. And high school senior Jordan Henry and Illinois State Representative Anna Moeller are working together to draft this legislation, and both join us now live to discuss this. Thanks to both of you. Jordan, I want to start with you. You are from Elgin, a senior at the Illinois Math and Science Academy. Let me start by asking you, if I could, what got you into substance abuse, the fight against it?
So what really got me into this was hearing so many stories from people in my community saying how they had a loved one or a friend or a parent have an opioid overdose, and so many fatalities like within my community. And this really sparked me to look into what our actions are against this, like looking into the war on drugs, looking into the history of the movement of harm reduction, and working with different organizations like the Illinois Harm Reduction and Recovery Coalition, as well as Live for Lolly, which is really close to my house. A bunch of different organizations talking to lots of people.
Okay, so you really felt the desire to help your community. So you came up with this idea of putting naloxone in public libraries. Why did you choose libraries as the avenue?
So really the aim of the bill is to expand the current program. It's a collaboration between the Chicago Department of Public Health and Chicago Public Library District. So they currently supply Narcan within all of Chicago's libraries. And seeing that, I was super, super inspired. And also seeing the AIDS Foundation of Chicago have their newsstands filled with naloxone for people to just come up and grab, no questions asked, and resources like that. Looking at my own home library, which is Gail Borden Library, it's one of my favorite places. I'm always there, like every single weekend. I'm always at the library, and I noticed how this could be such an amazing addition to our library. It already provides so much care, warmth for so many people, especially people who are experiencing homelessness. It's really the heart of our community, and adding this would help keep so many more people safe, and especially because libraries are centralized, so many more people across the state will be able to access Narcan.
Okay, so that's why libraries. Representative, I want to turn to you. This sounded like a good idea to you, so you're running with it. Tell us about how this process would work as it makes its way through Springfield.
Sure. So the bill is up right now, awaiting a hearing in the Public Health Committee, and we're hopeful that we'll get a hearing next week. I'm hopeful that we'll have bipartisan support because we know that this epidemic affects all parts of the state, including rural and southern Illinois, and could really benefit and save lives in those areas as well. Once the bill passes out of the House, we have a sponsor in the Senate, and then it would go on to the governor's office. We've been talking to the Department of Human Services and the Department of Public Health on how this bill will be implemented, and those details will be worked out as we move the bill through the process. But as you mentioned in your introduction, it's really hopeful to see programs like making sure that Narcan is available in communities have been working to reduce overdose deaths in Illinois. And I think this addition is going to help with that effort. And I'm just so proud of Jordan and all of the work that she's done to bring the issue to where it's at today.
Pretty amazing, Jordan. Just 18 years old. I know you hope that this will take the focus off punishment and put it more on treatment. So we'll be watching as it makes its way through Springfield. I want to take the time to thank you both for doing this and for being with us to explain it tonight. Appreciate it.